Welcome to another webcast in our series on eating disorders. I'm joined by Dr. Rebecca Emery. She's a researcher at the Department of Family Medicine and Biobehavioral Health at the University of Minnesota Medical School. Dr. Emery, thank you so much for participating in this webcast.
Sure, thanks for having me.
Can you tell us about emotional neglect during childhood and how this relates to eating disorders?
Sure. So emotional neglect occurs when the emotional needs of a child are either being ignored or invalidated by their parents or the people who are bringing them up. So, for example, a parent might undermine their child's emotional experience by saying something like, "Oh, it wasn't that bad," or "Stop being so dramatic." Or they may just not respond to their child's emotional needs at all. And whether it's intentional or not, these types of reactions are sort of implicitly telling the child that their emotions are wrong in some way, that the way they're feeling is not correct, that it's unacceptable, that they need to learn how to change it. And so to cope with this, some children will turn to things that they do have control over, like their eating behavior. So they may seek to exert control over their body or their shape through restriction of their eating. Or some kids might turn to overeating or binge eating, which we know can help to quickly regulate emotions in the moment. And so, kids in that stage of development are going to turn to what they know, what they do have control over in an environment where they often have little control in general. And over time, as those habits start solidifying, if they turn to food to try to regulate their emotions, that can increase their risk of later developing an eating disorder.
And what other forms of childhood maltreatment can lead to a higher risk of developing eating disorders later in life? Can you tell us a bit more about that?
Sure. So in the work that I've done, we've looked at a few different types of childhood maltreatment. So we've looked at maltreatment related to abuse, which is more overt, and we've also looked at neglect. And so what we've tend to find is that emotional neglect is not only one of the most frequently occurring types of maltreatment, but it's also the strongest and most consistent predictor, or at least it was the strongest and most consistent predictor in our sample of developing disordered eating in young adulthood. So for example, there was, for folks who had a history of childhood emotional neglect, there was a 40% higher risk of engaging in binge eating in young adulthood and a 30% higher risk of engaging in unhealthy weight control behaviors compared to those without a history of emotional neglect. And so those are pretty high odds, or at least greater increased odds than what you would see in a typical population. And in addition to emotional neglect, we also found that sexual abuse and emotional abuse emerged as predictors of later disordered eating. And interestingly, we found no link between physical abuse and later disordered eating, although that has not been as consistent in the literature. But what was really clear from our work is that the type of maltreatments linked to emotional abuse and emotional neglect seem to be the biggest predictors overall, regardless of sociodemographic characteristics, those sorts of things, that there seems to be something really tied in with maltreatment experiences that seem to disrupt emotional regulation and learning how to manage emotions that seems to increase risk for eating disorders.
So, and now if we know that childhood upbringing can lead to eating disorders, then does this not make the treatment of such disorders extremely difficult?
Yes, the short answer to that question is yes. And we know that eating disorders in general are notoriously challenging to treat. And for patients whose disordered eating developed in part to their reaction to their childhood experience, if they're seeking treatment for those behaviors later in adulthood, in young adulthood, or even later than that, these habits and these cognitions and this pathology have had years to develop and solidify into habits. So getting in there and changing those things takes a lot of time and a lot of effort. But we have developed really effective treatments, and many people who seek therapy and guidance for recovery from an eating disorder will eventually achieve a point where they're no longer symptomatic.
Can you tell us also a little bit about where you now see next the further need for research? And maybe you can also tell us a little bit about what you are currently working on.
Sure. So, given this work showing that childhood maltreatment and traumatic experiences are pretty strong predictors of eating disorders and disordered eating, from my perspective, there seems to be a need to start integrating trauma-informed approaches into eating disorder treatment. So tackling both the disordered eating and the adversity that may have contributed to it will likely have a huge benefit on patient outcomes if we can take that dual-pronged approach. But taking even a further step backwards, I think truly the biggest area for future research is not just in the treatment of disordered eating, but it's in the prevention of disordered eating among individuals who have been exposed to maltreatment in childhood. So if we can identify at an early age children who have experienced maltreatment, either emotional neglect, emotional abuse, whatever it may be, how do we then develop programs that can come in to teach that child how to cope effectively with their emotions, to get them out of an unsafe environment, to prevent them from developing these disordered eating or unhealthy coping behaviors in general. And so that, to me, is where I see a particular need for not only research, but also policy efforts, and just larger focus on a societal level of how do we go about preventing these things from developing. And I am not personally working on that. That's beyond my scope of research and beyond my scope of expertise. Much of my work focuses on points of vulnerability in someone's life where they may be at increased risk for developing an eating disorder. So right now, a lot of my work is looking at how pregnancy and postpartum periods actually serve as a point where you might see someone who's experienced adversity having an even harder time managing their emotions or their behaviors. And so I tend to really focus on these vulnerable periods. So in this paper, I focused on periods of young adulthood, which are full of transition. And much of my other work looks at pregnancy and postpartum as another period of transition where we may see an exacerbation in these types of symptoms for folks who have been exposed to trauma or maltreatment earlier.
So Dr. Emery, for people watching this webcast that may suffer from eating disorders due to a difficult childhood upbringing, do you perhaps have some good advice to share?
I think from my perspective as a psychologist who has done a lot of work treating patients who are experiencing eating disorders, my biggest piece of advice is to seek help, either from a professional or a trusted loved one or both. Eating disorders often feel very isolating and all-consuming to the individual experiencing them. And so I always like to make it clear that there are resources and people out there who want to support individuals who are experiencing these difficulties. And so if this is something that a listener is struggling with, I would advise them to seek help and see if they can start working on some of the root causes that may have led to this.
Dr. Emery, thank you very much for taking the time today and speaking on this important subject. I wish you all the best with your further research, and hopefully we will see you again at some point in the future. Thank you.
Thank you.